Welcome back, everyone. Keith McGilvery once again, and it's time for today's Health Watch. We're joined by Dr. Hussain, our friend from Trinity Health of New England. Dr. Hussain, we're saying good morning. It's the overnight hours for you. Boy, are you loyal, joining us from Sydney, Australia this morning.
Morning. Yes, thank you for having me.
Yeah, so great to have you with us. Listen, you're a pro, so we'll get right to it. Doesn't matter what continent you're on, we will find you and we'll bring you our questions. So curious, there's so much talk right now. Kids are on vacation. We're headed into winter. Flu, COVID, RSV. What are your big picture thoughts on kind of where that scenario stands right now?
Yeah, so great question. So it's still early days in terms of how the holidays will impact what we're seeing with these respiratory viruses. There is a silver lining, though. We've seen over the last few weeks, RSV has sort of plateaued across the nation, which is great. Flu over the last couple of weeks per CDC data seems to have, at least hospitalizations have gone down week over week. We'll see if that is sustained or if that's a little bit of a blip. COVID cases have gone up, but they are much lower compared to the previous two surges we've had during the winter months. Still, like I said, early days, but promising. We'll have to keep an eye on it, and folks need to remember that taking public health measures and getting vaccinated are great tools in our arsenal to keep ourselves safe.
All right, Doctor, for folks who joined us a little bit earlier on this morning, we shared a story about strep, as if parents don't have enough to think about right now and worry about. What is your perspective on that front? Is a strep outbreak potentially on the horizon here?
So we don't have anything right now in the U.S., but the CDC is monitoring what's happening in Europe, especially in the U.K., Ireland, France, and other countries where they have seen an increase and actually some deaths resulting from strep infections. So this is not surprising. We do tend to see higher bacterial infections when there is a uptick in viral infections. But so that would need to be closely monitored. We also do have some antibiotic shortages across the country. Although there are alternatives, nothing to panic, but we'll need to keep a close eye in the coming weeks.
All right, appreciate that. And then also curious about this. I've been working with Lauren this week, sitting next to her. I mean, she shared her story with me this morning, saying that she and her mom, I think, visited some 9 stores in our area yesterday, trying to find children's Tylenol for little Charlotte here. It is a scenario that a lot of families are encountering right now. Stores have limitations on how much you can buy. This shortage here, what is the impact on that front? What are your thoughts there?
Yeah, the shortage across the nation that we're experiencing with some medications, especially pediatric, is directly related to the really high numbers of RSV and respiratory cases we're seeing, which is unprecedented at this time of year, this season. But nothing to panic is what I would tell our viewers, our parents in particular. It's important that you talk to your pediatrician, your child's pediatrician, and because there could be adult medication that can be modified for a pediatric dose based on your child's age and weight. But a pediatrician will be able to determine that and which medications are your child can take. So that's why I say don't panic, talk to your child's pediatrician, and please do not panic buy medications so that those that really need those meds have access to them when they go to the pharmacy.
We've asked families to juggle a whole lot over the last couple of years. As we head into the new year, curious if you have any overall thoughts on kind of goals as we head into 2023 when it comes to our health.
Sure. Yeah. Still not late to get that COVID-19 booster. Right now, the bivalent booster, if you're eligible. We know uptick has been very slow across the nation. And along with, as we continue New Year's gatherings and other family gatherings, that it's important that we take public health measures into account. That includes pre-gathering testing, rapid testing for COVID, along with wearing a mask when you're in an indoor crowded situation. Not a bad idea.
Dr. Hussain, know that as we head into the new year, we are grateful to have you as part of our extended Fox 61 family, kind of walking us through the complicated, making it easy to understand. So we appreciate that. And as you ring in the new year from Sydney, well ahead of us, Happy New Year, my friend.
Thank you. And you too, and to the Fox 61 family, thank you for being amazing partners throughout these few years.
Yeah, appreciate it. Enjoy your time.
Thank you.